National Influenza Vaccination Week. And joining us this morning is Ashleigh English. Good morning, Ashleigh. Good to see you.
Good morning.
There's a lot going on, isn't there?
There is, and sadly, the flu is in full force. It's out there, it's moving around, but it's not too late to get your flu shot. The peak seasons are January, February. That's why they do say you don't really want to get a flu shot in August. You don't want to get it too early. Usually we would like you to have it by Halloween, but you can still get it, and you really should still get that influenza shot. Flu is the second leading cause of death from a vaccine-preventable disease next to COVID only. During COVID, we didn't see as much flu because people weren't out and about and getting around others. But it can be a very deadly disease, particularly for the very young and those over 65. I wasn't going to say the very old, but those over 65 and young kids are the most susceptible, but it can impact anybody. And I don't know, I just don't want to take the time to be sick. So, getting that flu vaccine, it only takes a few seconds. I also wanted, a lot of times people say, well, I got the flu vaccine and I got sick. Well, symptoms of achiness, maybe a mild temperature, little stomach thing, that's not necessarily flu. That could just be a bug that you coincidentally caught. We also have, it does take about 1 to 2 weeks for the flu vaccine to become as strong as it needs to be in fighting in your body. So, you get the flu vaccine, and in that week or two after you got it, you come in contact with somebody and you catch the flu. You're not really fully protected. So there is a chance that you could catch the flu, but it's not from the vaccine. It is from
others.
Your immune system just wasn't there to protect it. And then we also have, I got the flu shot, and, I still ended up 2 months later with the flu. But most likely, your symptoms are much less and a shorter duration. I was just talking to a woman the other day, and this is a couple that's in their 30s, and she said in 2016, she remembered the date. She said, my husband and I both got the flu. I'd had the flu shot, and she said, I was down about a day and a half, feeling pretty yucky. He was out for 2 weeks. He had not gotten the flu shot. So she said that was kind of ours, like, wow. Both young, healthy, mid-30s folks, and just the difference. So it might not, you might still get the flu, but it's not going to become something that just knocks you down for days and days.
You bring up an interesting point with even the environment we're in now, where employers are probably in need of people to work. So the ones that are coming in working, if any one of those take off because of getting sick, that can be really hurtful for the business. For the business. And also for the person making the money and collecting a paycheck.
Right. Because, how much sick time do you have? If you have sick time, if you're in a job where you have sick time, do you want to use it all in one fell swoop? Or, because if you're somebody with kids and flu's going through your house, you can be several weeks getting that under control. So, and even with kids in school, we don't need kids missing any more school than they already have. We're going to be years trying to decipher what, the pandemic's done in terms of missed education for kids. So we need our kids to be in school. And, again, a case of a flu goes through a classroom, they can wipe out half the class, let alone the teacher. And we know, too, we have a shortage of teachers right now. So it's just so very important. And it's so easy. It really is easy. You can walk into any pharmacy and say, I want my flu shot. And, pharmacies are generally going 9 to 9, pretty much almost 7 days a week. Adagio Mobile Health Unit will be at the YWCA December 22nd. So that's the Thursday right before Christmas. So maybe protect the ones you love for the holiday season. Whether you have insurance or not, whether you're male or female, whatever the age, if you stop by the mobile van, They will gladly, make sure that you get that immunization. Also, they can get you with the COVID. This year, I decided I was just going to do it in one fell swoop. So if I felt a little sore, a little sad, so, flu in one arm, COVID in the other.
Well, that's another question people sometimes ask. Can you get more than one vaccination, or do you have to stagger it? Okay.
Yes, you can. At least, I would say definitely for a healthy individual. Yes, that is. And I just decided, you know what, I'm just going to get them both done at the same time. Some people choose not to do that, but I just thought, I'm here. Let's get them done. Did have some soreness on my arms. Not going to, pretend that I didn't. But actually, that was pretty much my only symptom with either of those vaccines. So, and it is hard. Kids don't want to be vaccinated. That's a scary thing, getting a shot. You may be able to talk to a doctor about if they have the nasal mist for your kid, if it's really something that scares them. But and we do encourage that people use their pediatricians for those immunizations so that the pediatrician knows the kid and has contact with them. But if it's something that's really anxiety-provoking, I always think about when we pull up to the vet, my dog knows immediately where we're at. And kids, if they've had some times where they equate the doctor's office with, when they've been really sick or they, have had to, then just, hey, let's run to, the store and blah, 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 and then get them done quick and get them out of there. And, maybe you treat them to a little piece of gum or whatever just to make it all better. So there's lots of little tricks you can do, and it is so readily available that it's really important that take the time to do that.
Well, the other thing about maybe going to the pediatrician is just updating records and making sure the other shots have been
absolutely.
So
I'm always going to say that's your best option. But if you just can't, if the time is an issue, maybe it's just not working with your work schedule to get your kids in there, or different things that are just prohibitive for you. Just get the kid the immunization. But yeah, definitely always go to the pediatrician if that's a possibility. But if that's not available, there are other avenues for you to take. And we know right now the World Health Organization has been really, PBS just did a spot in the last week or so. It was very interesting. Immunizations around the world are down for childhood immunizations about 25%.
Really?
And a lot of that has to do with healthcare systems being strained, so we weren't doing as much general public health, so particularly in Africa and remote areas. And that's a scary thing because we don't want to see those diseases coming back. And we have such a small world anymore with travel and people going here and going there that we know that if it's, it can be oceans away, but it doesn't have to take too long and those diseases start showing up.
Well, I think people were watching even the spread of COVID and the variants and how quickly it would move from one country to another. And,
right.
And then you do realize, it is a small world.
It is a small world. It takes, somebody coming in on a plane and they have brought it in and maybe exposed this person and that person. And like I said, this week is National Influenza Week, so that's our primary focus. But yeah, getting all those immunizations and making sure your kids are caught up and that you're caught up. Adults, do you have your shingles? If you're over 50, you can get that shingles vaccine. If recommending pneumonia for those over 65. I feel like I've gotten more shots in me probably since I was about 10 years old. So, but I want to be healthy, and like I said, I don't have time to be sick, and I don't think anybody else does either. So,
you're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel, and listening to it on the Allegheny News Talk Sports Network. Ashleigh English with us here this morning, and you mentioned, safe to get the flu shot with other things, including like shingles and.
It is the CDC. Well, I don't know if they'd recommend that, but I know right now CDC is saying that you can get the flu and COVID at the same time. So don't quote me on, because shingles is a two-part vaccination.
Yeah,
so I don't know that
I'm looking at a sheet here. It says flu vaccine can be given at the same time as other vaccines, including those that protect against COVID-19, shingles, and pneumonia.
Then there you go. So it's a one-stop shop. And like I said, again, Adagio, the mobile van. So if you're ever driving down Franklin Street in Titusville on the fourth Thursday, usually in the month, and you see this great big van parked in our parking lot, that is Adagio Women's Health, but they will immunize men. They will immunize people of all ages, and that is not. You don't have to have insurance for them to do that. So if you're uninsured, that's a great place to make sure that you are grabbing your.
Do they need an appointment, or can they?
They can just drop in. I mean, I think any place will always say, yeah, we prefer an appointment, but if it's going to maybe change if you have to wait a few minutes.
Yeah.
But no, you can just drop in and get yourself taken care of.
Are there questions anymore with pregnancies? Is it safe to get shots?
They still recommend that you would have that vaccination, and they will for flu, because you don't want to be pregnant and end up with the flu. And any child over the age of 6 months, it is recommended that they too get the flu. So unless you have contraindications that your physician's going to talk to you about, it is a safe vaccine. And no, it doesn't mean, okay, I've got armor around me, I'm not going to perhaps get sick at all, but hopefully it's going to shorten the duration of that illness and protect you and people around you.
And again, whether it's stopping to see you when you have that's the 22nd of December?
22nd of December, the Adagio will be at the YWCA.
Okay, or making an appointment with your doctor.
Make an appointment with your doctor, stop into any local pharmacy, because time is important to folks. It's like grab your groceries and get your flu shot, or, run into the pharmacy and...
Well, I think, you were talking about some of the stats, when you started seeing, I think it was New York, polio cases spike in certain communities. It's like, oh, this is something that we haven't talked about in a long time.
Absolutely.
But it makes you, again, go back and say, okay, are people getting up to date? And we know the last couple of years has thrown a lot of people off. Mm-hmm. But, it's an important time to make that appointment. And whether it's this or getting a physical and, look at Kirstie Alley. I mean, that was a situation that was just terrible to see. But, make that appointment, get into your doctor, get checked up. And if you have been doing that, as you said, go to a pharmacy. There's a lot of places you can go to get the flu shot or other things that you might be missing out on.
Right. We're always going to say your physician first, your family doctor first, and particularly for children. Go to that pediatrician. But if it's just not in your schedule to make that happen, there's other alternatives for you.
Well, National Influenza Vaccination Week is this week. So while we're talking about it, think about it. Get something scheduled, or stop in and just take care of it and be done with it. And you mentioned that it takes a couple weeks. This would be great, especially if you're going to be visiting family.
Get it now. You're and then you should have some flu armor on you for Christmas. I will say too, we have through our community is immunity is community grant. We do have a lot of COVID testing kits. So if you are somebody that needs some of those kits, look me up at the YWCA Titusville. And gladly get you some of those if, because I know now people are having to pay for them at certain things, or you have to go pick them up at the pharmacy if you have Medicare. So we can help you out with that. Would love to. Actually, I'd love to get rid of some of them because I've got a lot. So a little swab before the holiday season.
Yeah. But again, a great time to be thinking about that and just taking care of it, and then that way you don't have to worry about it, because you are coming into that time where you're probably going to be with family or friends and
inside and indoors.
Yeah,
and we're indoors now. It's that time of year. When we gather, we're generally inside for the next couple months.
Yeah, these temperatures up and down, up and down. Yeah. All right. Well, Ashleigh, thank you so much for your time. Again, if folks have any questions about any of this stuff or want to learn more, can they contact you at the Y?
They can. I'm going to say look at the CDC. They've got great information posted, as well as, there's lots of different resources online, but I would gladly point folks in the direction, or talk to your doctor. That's the other, and I know doctors are pretty busy people. So, but when you're in there, talk to them, see what their thoughts are, but also educate yourself.
All right, and we'll see you next week.
Thank you. Yep.
Thank you, Ashleigh. Appreciate it. Thank you. Ashleigh English joining us here this morning.